You just bought a dental practice. You're excited. You got all these ideas and you want to implement them. But having that one-on-one conversation, what's working, what's not working, it gives your team a voice and they feel heard. Now, whether you take that advice or not, but at least they were able to express themselves. And I don't think people realize that there is a grief process that you go through during a transition.
It requires the buyer to come in with some measure of humility. And people aren't good at humility, right? Like, we're all bad at it. We're all trying to get better. But it requires the buyer to come in listening instead of speaking, coming in wanting to learn instead of wanting to teach. Hello, everyone, and welcome back to another episode of the Dental Truth Project. We're very excited for our guest today, but before we hear from her and her truth, we are going to jump over to Ken for the Ask Ken segment.
All right. I'm going to warn you right now. I'm going to geek out a little bit here for a second in some finance terms, but hopefully we'll come out unscathed as I just walk us through this. So the question that came in from a listener is this: how much debt is too much for a growing DSO? I think it's a great question. You're thinking right, because you want to make sure, because too much debt gets you in trouble. Too little debt can also get you in trouble, depending on how you're structured. So here's the primary concept that I want you to take away from this. There is something in finance, and we love to create ratios and all these different types of things. There is something called a debt service coverage ratio. And this is what will help you decide if you have too much or too little debt, depending on what's happening in your organization. So the ratio is called the debt service coverage ratio, or the DSCR, if you use the acronym. And what's happening here is we're looking at the total profitability of the organization over a period of time. And then we are measuring that against how much cash you're deploying during the period in order for you to service the debt. So here's the primary formula. The debt service coverage ratio is your net operating income divided by your debt service. And by using that ratio, what that does for you is it tells you, relative to your income, how much debt do you have. And in essence, if the ratio is at 0, what that means is that you literally have no extra cash available after you service your debt. Banks will not generally deal with that type of a situation. Banks will usually want to see a 1.25, a 1.5, sometimes a 2 times of a debt service. And that generally is a healthy place to be in your organization. And so I'll stop here. There's a lot of nuances to this, but I guess the one last thing I'll say is if you're thinking about raising debt of any type, if you show up to that lender and you tell them, hey, I know what my debt service coverage ratio is. It's this, and it's this, and it's this. And if you go and you are proactive, you are going to impress the lender, and hopefully they'll start to trust you and see that you're a good operator in your organization. So thank you to whoever sent in this question, and happy to always get into debt coverage ratios and other fun finance topics. All right, Dallin, I'll pass it back to you.
All right. Thank you for that, Ken. Debt service coverage ratio. We work with a lot of groups that are trying to raise a lot of debt. So I know that can be helpful for a lot of people. Christine, the time is now yours. We're going to pass this over to you. Start out by just introducing yourself. Give us a quick background, and then you can jump straight into the truth you want to share with our listeners today.
So I'm Christine Diehl. I've been a dental hygienist for over 30 years. I had a situation where my practice was bought by a DSO, and so we went through a transition. Now, fortunately for us, our transition went well, but when I started talking to other people about their transitions, it was not good. I heard so many horror stories. I just actually had one recently where the hygienist had worked with that dentist for 20 years and he sold to a DSO, and the DSO transition team came in and it just didn't go well. Even the doctor seemed very stressed out. He got the team together and told them if they didn't take this deal, they were stupid, which always makes people feel like, yeah, let's take the deal. So I'm really passionate about helping this transition process because I don't think it has to have these dire outcomes. And in the space right now, retaining a hygienist is really crucial to your success. So losing any team member during a transition can be devastating because they know your patients. They know how things run. They know the office. So that's kind of what I concentrate on, is helping kind of that grieving process for the first 90 days as you're transitioning, whether you're a seller or a buyer. And they both have different wants and needs. Sellers really probably go into this with very good intentions about selling to a good practice or buyer or DSO. And I think they really care about their teams. So in that respect, I can help them facilitate that aspect. And with buyers really need to know some information about team dynamics. There's often a leader in your practice who's not an official leader, but once you have that person on board, everyone else will get on board. So it's pretty important to know who that person is. So finding that information out from your seller is definitely something I would recommend. One thing I don't think doctors think about enough is I hear a lot of bashing of DSOs. That just kind of comes with the territory. And then you sell to one. So buyer beware, seller beware. You might want to change some of your perception on what a DSO is and the value it can bring before you sell to one. Because that's what happened in my situation. And our doctor was always like, DSOs are bad, and then sold to one. So,
how do you reverse that narrative, right?
Right? Exactly. So what does that tell us as employees if you do that? Yeah. So I just want to make sure, there are good DSOs, there are bad DSOs, there are good private practices, there are bad private practices. Mm-hmm. It's just something that I want people to keep in mind. Just because you're a solo practitioner and you don't like DSOs per se, doesn't mean that all DSOs are bad.
So, Christine, I've got a question for you on this, just to kind of kick this off and thank you for explaining that. I think you painted the picture very well. Every dental practice has a culture, whether they've purposefully created that or they've let it just sort of morph into whatever it is, and sometimes that can create challenges. But what I'd love to hear you talk about is how does in transition where a culture exists, but you have maybe some new players that are now part of the group or maybe it's a leadership person that's overseeing it or whatever. I'd love to hear your thoughts about how do you manage that so that it can be successful in a transition?
I think you have to match your vision with the current culture initially. So, not changing anything. I'm a big component of really not changing too much in the first 90 days. Okay. This is a kind of getting to know you time frame where you kind of learn more about the culture and what's working and what's not working. I think one of the big questions to ask team members would be, what do you not want to see changed? And what do you think can be improved?
Okay.
Because that way, right off the bat, what are things that are almost non-negotiable for that particular person? So what is it that they really love about the practice and they don't want to see that part of it change? So I think learning about the culture and trying to align your vision of what you want the practice to be with the culture initially is going to gain you more trust.
I think that's a critical component right there. And it's hard because it requires the buyer to come in with some measure of humility. And people aren't good at humility, right? We're all bad at it. We're all trying to get better. But it requires the buyer to come in listening instead of speaking, coming in wanting to learn instead of wanting to teach. I heard a story about a college university in the United States that got a new university president. And the university president came in and everyone was expecting big changes and he's going to overhaul this program and he's going to do something different here. And he came in and said, I refuse to change anything for the first 3 months. It was that same 90-day policy. And he said, I'm going to spend these first 3 months and I'm just going to talk to everyone. I'm going to talk to this department, that department, and I'm going to listen. And I'm going to hold myself to not changing anything for the first 90 days. Now, on the 91st day, there was a lot of stuff that changed, but it gave him the ability to listen and to learn and to figure out what was working and what wasn't, so that the right changes could be made after that period of time. And that's not me saying that, like, you cannot change anything within the first 3 months, but this idea of coming in and trying to listen and learn rather than guns blazing, let's fix everything. It's hard. It requires humility, but it's what makes sure the right changes are being made instead of making some errors in the beginning that are going to come back to haunt you later.
I think I get it. Like, you just bought a dental practice. You're excited. You got all these ideas and you want to implement them. And I love new dentists because I think they're so awesome because they have so much energy and optimism. But I think getting to know your team first is going to be where you'll learn the most about the practice. And like you said, having that one-on-one conversation, what's working, what's not working, it gives your team a voice and they feel heard. Now, whether you take that advice or not, but at least they were able to express themselves. And I don't think people realize that there is a grief process that you go through during a transition, because it's not going to be what it was or what you were used to. And change is hard for everyone. Let's face it, nobody wants to change. So I do think that we have to allow people to have that time to grieve.
Yeah, and I think that grief is the right word for it. Like, when you first said that, I was like, oh, that's a little strong. And then the more I thought about it, I was like, no, that's actually pretty legitimate. Because again, human nature, we all resist change, especially when something is good. You know, maybe if this is an awful practice, they're hoping that new DSO is going to come in and change things and it's all going to be different. But most of the time, people are working there because they want to work there, because they like working there and they've developed relationships. And there's this fear of big bad coming in that's going to change everything and it's totally going to be different. And while you can't guarantee that nothing will change and everything's going to stay the same, I think you're right that giving people time to process it, and especially to voice their opinion so they feel heard, is critical. I've noticed that just in my own life, like working with my own team, most people are willing to buy into change as long as they've had the ability to voice their opinion. And even if you don't end up going with what they said, like even if you don't follow their opinion, as long as they were able to express it and they felt heard and acknowledged and they know that that was weighed and considered, that makes it a little bit better. And it's a little bit easier then to buy into a new direction.
Yeah, I totally agree with that. People want to feel heard. People want to feel, they want to feel included. A lot of the people that are in these practices have been there for years and years. Mm-hmm. So they have established relationships with patients. They have, a way of doing things. And it might not be the way you do it, but it's worth your time and effort to just observe and find out what's working. Because that transfer of trust from a hygienist who's been there 20 years to the new doctor is huge. Your patients are going to trust you because Christine said, Dr. So-and-so is wonderful. You're going to love him. Mm. So it's really important that your team trusts you and you trust them.
Now, a couple of questions. Maybe I'll just start with one question here. To me, it seems like having somebody come in and manage the transition, that most doctors would say, well, I can just do this. Or maybe, it's a DSO group that says, hey, we just come in and we're just going to change some things around and do whatever. I'm curious, like how do you convince somebody to bring somebody like you in where you're going to bring a lot of value in the transition, but perhaps those that are transitioning, maybe they're like, hey, I'm fine if everybody leaves, or I don't care about the culture. I'm going to redo everything here anyway. And I'm being cavalier in the way I'm saying it because I do think some of them think, oh, well, it's no big deal. Like we'll just slap some things together and, maybe move a couple of, team members around and call it good. How do you help them understand the value proposition that you bring to the table with them.
Yeah. In this environment, if you lose one hygienist, it could end up costing you anywhere from $30,000 to $120,000. So if you think about it, this is a risk mitigation to bring me in, because you've just paid a lot for this office and you start losing team members, $100,000, $30,000, $60,000. There's patients that are going to go with them. So you're going to have the problem of hiring a temp at an extraordinary rate. And there's going to be a cost with that. If there's going to be a cost for recruiting, then if you lose patients, now you're marketing more to new patients. There is a big cost involved in this. And I don't think people realize that. And like you said, they just think they're going to wing it. And that's just not going to work, because these people are really important to your success, and it can cost you a lot of money.
Yeah, that makes a lot of sense to me.
Well, and like with the DSO situation, I don't know too many DSOs or emerging DSOs that are going to buy 35 practices this year. So I hear all the time, well, we have a transition team that we bring in. Yeah, you may have a transition team, but is that really their main focus 24/7? Or is that just we threw some people in and said, that's our transition team? And then on the team side, for a team member, I know that this transition team, HR or whoever, they're not looking at my best interest. They're looking at their corporate bottom line. So to have someone independent of that organization help during this difficult time, I think it's just so valuable to help risk mitigation, retention, all those things that we want to help to keep the practice moving productively and successfully forward.
Well, and I think you doing something like this from an unbiased perspective is the best way. It's going to create the best outcome in the process. That's the thought that keeps coming back in my mind is this is an unbiased individual who's going to come in and make sure that as much of the value that's in that dental practice can be retained, but it's got to be an unbiased individual who makes sure that all the right levers are being pulled.
And I want everyone to be successful. I want the buyer to be successful. I want the team to be successful. And being a team member myself, having gone through this, I think brings a lot of validation to the situation.
Oh, yeah.
Like, I've been there. I know what you're feeling. It's very scary, just to be that person that can take on some of that soundboarding. And there are things people will tell someone on the outside that they won't tell someone on the inside.
So true. So true.
And to be able to communicate that to the new buyers and let them know, like, here are the concerns that you're not really hearing. And to be able to, communicate that, and then maybe we need to make some changes. And I really work with sellers and buyers on those things. Like I told that story earlier about the seller who said, if you don't take this deal, you're stupid. Like, I would have been like, yeah, we were not going to say that at the first meeting. And it seems common sense, right? Like, I wrote a whole book that's common sense, and it's just funny that when we get into those situations, common sense sometimes isn't working. We are in a state of panic or anxiety or depression for that matter. And so common sense is out the window, and we're not really putting our best foot forward.
Yeah. Well, I think it makes tons of sense. And it's about time for us to wrap up our episode here. But Christine, if any of our listeners are curious about the topics that we've discussed and they want to talk to you more about it, what's the best way for them to reach out to you?
They can reach me on LinkedIn at Christine Diehl, and then also on my website, dynamicteamtransition.com.
All right. There you have it, folks. Thank you, Christine, for coming on today. I think we were able to create a ton of value here talking about effective transitions, why oftentimes they don't work, and things that dental teams can do to make them more effective. So thank you very much for coming on.
Thanks for having me.